First you need your supplies, and the supplies that you'll need is your lancing device, your lancets, which will stick your finger, the glucose meter, and your test strips. First we'll load the lancing device with the lancets, and in order to do that you pull the cap off the top of the lancing device and you push the drum of needles into the lancing device till it clicks into place. And you put the cap back on. The next thing we'll do is get the meter ready by taking a test strip, pulling it out of the container, taking the test strip and inserting it into the glucose meter. The gold end goes into the meter and the yellow end is where the blood goes. So you push the strip into the meter, it turns the meter on. It's going to flash with a little timer showing us that it's checking everything, and then it will flash with a drop of blood. When it flashes with a drop of blood, it's telling you you're ready to stick your finger. So at that point, you put the lancing device next to the side of your finger and push the button, and that will give you your drop of blood. And as soon as I get my gloves on, we'll get going with this. Okay, so you put it off to the side on the fleshy part and push. We're going to get the drop of blood, and we're going to stick this into the drop of blood. It'll beep when it's got enough blood, and in 5 seconds it will read out what the blood sugar is, 112. So that's the blood sugar, 112. Okay, the definition of high blood sugar is anything greater than 200. However, you may be greater than 200 if you ate wrong or did something that you know why the number is high. It's only when the number is high and you have no idea why the number is high that you need to worry about a blood sugar. If your blood sugar went high after you ate, and as long as you check in 3 or 4 hours and it's come back down again, that's the key. It's when it stays high, you check. If you get a 200 number, you check again in 4 hours. Drink some water. Water or fluids will always, non-calorie fluids will always bring a blood sugar down. If you missed your medicine or you need to take insulin, those things would be a good thing to do if your blood sugar is high. If it stays high over a 4-hour period or is not coming down, that's an automatic call to the doctor. The definition of low blood sugar or hypoglycemia is anything less than 70 or with symptoms of low blood sugar. Less than 70, or automatically, most people will know it. Not like high blood sugars where you don't always know it. A low blood sugar you'll know because you'll feel it. You get weak, shaky, sweaty, you're hungry, you know you need to eat. The key is to get something to eat. If you're somewhere where you can eat, you get something, some kind of fast-acting sugar like a regular soda, orange juice. Carry glucose tablets with you, chew 2 or 3 glucose tablets, some kind of soft all sugar candy like gummy bears or jelly beans. Those types of things will bring your blood sugar up. You check in 15 minutes. If your blood sugar isn't any better, you retreat it. If you do it twice and it's not up to normal, that's an automatic call to the doctor.